Hello and welcome to Healing Touch Review of Techniques Level 2. I'm Ann Day and I'm a certified Healing Touch practitioner and instructor. I have been teaching Healing Touch for over 20 years and have taught all over the world and over 1,000 students. I'm also a certified holistic nurse, a massage therapist, and I have a master's in health and wellness. I am dedicating these videos to Janet Menken, who is the founder of Healing Touch and also founded Healing Touch International Organization, now known as Healing Beyond Borders. Janet was a friend, a mentor, and a colleague of mine for many years. Janet had a vision of having a Healing Touch practitioner or student in every home, and I am upholding that vision by continuing to teach Healing Touch to as many people as possible, and that's part of the reason that I'm also sharing with you through these videos. This is the second of a series of 4 technique review videos. I hope that you have the level 1 technique review and have enjoyed using it. The purpose of these videos is to help you practice and deepen your experience of each level of Healing Touch. I trust that if you're looking at this video, that you've taken a Healing Touch Level 2 class. These videos are not to replace taking classes because the classes are very experiential and you learn so much with the exchange of giving and receiving in the class. So the purpose is really to deepen your understanding and practice of these Level 2 techniques. As I said in the Level 1 Healing Touch Technique Review video, I am demonstrating these techniques as I learned them years ago from Janet Menken and as I've taught them to many people over this time that I've been an instructor. However, please understand that there might be slight variations in what you see on this video compared to how you learned it in your class. These techniques are taught in a very uniform manner. However, some instructors might interpret them slightly differently. The important thing is that you remember the principle we teach that energy follows intent. And if you set your intention, the energy will go where it needs to go. So please practice these and trust that you are learning them in just the perfect way for you. I want to introduce our client for these Level 2 video techniques review. Her name is Andrea. And the word client or patient are interchangeable when you do this work, but I'll be using the word client in these videos. I want to begin with a short centering meditation. This is always a good way to start any of your practice, and it puts you in a place where you're centered, grounded, and can set intention. So just take a moment before we begin this first technique to close your eyes, to take a nice deep breath, and to allow yourself to go to that quiet inner space. With each breath, just feel yourself settling in, letting go of any distractions, and being very present in this moment. Also see yourself grounded, which is connected to the earth, accessing the earth energy, connected, grounded, balanced, present, centered. This is also an important time during your centering to set the intention for the highest and best for the person that you'll be working with. So I'm setting the intention for the highest and best for Andrea as we go through this first technique. The first technique that I'm going to review today is the chakra spread. The chakra spread is actually taught in Level 1, so you may remember it. But this is a variation of the chakra spread to show you that it can be done easily in a chair. If you remember, the intention for the chakra spread is to open the energy profoundly and expand it. And it's used for transitions of any kind. These can be life change transitions or to work with someone who's in the dying process. So the chakra spread is a wonderful technique, very profound, and I'm going to demonstrate it so you can see how to do it in a chair. So we're going to have Andrea push back a little bit so she can be comfortable here. Remember, we started with the centering and grounding, which is always the best way to start any of these techniques. So Andrea, as I start this chakra spread in the chair, I'd like you to just relax and set your intention to open to receive. So take a breath, close your eyes, and I'm going to begin with the soles of the feet. Just as we taught in level 1, chakra spread, holding the sole of the foot one at a time for about a minute. This opens up the chakras at the foot and allows any congested energy to drain easily. It's best to hold each of these positions approximately a minute. I might be moving just a little bit faster for demonstration purposes. I'm going to the second foot now, and I always make sure that the palm of my hand is against the chakra at the sole of the foot. Again, opening this foot, holding it for about a minute. And for demonstration purposes, I may be moving a little faster than you would do with this, perhaps a little faster than a minute, but the intention is to hold each position for a minute. We next go to the hands, palm to palm, so that the chakras of the palms are together. And as I hold the hand, I am setting the intention to open the flow in the hand. Again, this helps to drain any excess energy as well as just facilitate the expansion and flow of energy. You want to hold each hand approximately a minute, just as you did with the feet. One hand and then the other hand. Holding a minute, energy back and forth between your palm and the palm of the client, keeping them very relaxed. Now that I've finished with the hands, you go behind the person and begin spreading, beginning with the crown chakra first. You're spreading and expanding the energy of the crown chakra 3 times. Then over the brow 3 times. Let your hands be soft. Just feel the energy of the chakra and that you're opening and spreading it. Then over the throat 3 times. After the throat, then you spread the energy of the heart chakra 3 times. Then come around to the front and begin with the solar 3 times. Then the sacral. Each one is 3. Then you spread over the root 3 times. The next spread is over the knees. Then the ankles, spreading over the ankles 3 times. And then off each foot 3 times, just as though you're pulling off an energy sock, with hands on either side, or one can be just below the foot, pulling off the energy of each foot. So then you go back to the crown, and again spread 3 times. The number 3 seems to be a sacred healing number, so it's often used that in different techniques they are done 3 times. Now I'm doing the throat. Then the heart. And then you'll come around again to do the solar, 3 times over the solar plexus. Then moving to the sacral chakra, lower abdomen 3 times. Moving to the root. Then to the knees. Then over the ankles 3 times, spreading the energy. And then again, each foot, just imagining that you're pulling off an energetic sock off of each foot. So the last time, again starting with the crown, 3 times. Over the brow 3 times. Then to the throat. Then to the heart. Then come around and moving to the solar chakra. Then to the sacral chakra. Next, the root again. Really spreading that energy very smoothly. Then to the knees. The ankles. And the last time with the feet. Once you finish the feet, the way we end is to hold the hand again, palm to palm, and another hand over the heart, either touching the heart or just above the heart, really ending with that loving connection, heart to heart, with the client. This is a very profound technique, and it really expands the energy field of the client. So therefore, if this person that you're working on is going to get up and go and do other activities, you want to make sure that you've grounded the person so that they can bring their energy field back into connection with the earth and a normal distance from their body. If the person is going to stay in a bed or a chair, if this person is having a very serious illness or perhaps in the process of transition from this life, then you do not have to ground the person. Just let them be very relaxed to end. In level 2, we began to teach you about the 9-step treatment sequence that then you will be using throughout the rest of the levels of Healing Touch. In level 2, you learn about a full 1-hour sequence using these 9 steps. The steps are, number 1, your intake, and if it's after you've seen someone before, then there's an update. The second step is the healer preparation, and that is where the healer centers, grounds, and sets intention for the treatment. The third step is the pre-treatment energy assessment, which we do with our pendulum and our hands. The fourth step is the problem statement or healer appraisal, where the healer then puts together what they have assessed by doing the energy field assessment along with what the client has told them is in the intake. The fifth step is then finalizing the goals with the client on what they want to work on during the treatment. The sixth step is then the healing touch interventions that you select, which is determined by what you have assessed in the energy field and what is going on with the client. The seventh step is a post-treatment energy assessment, which is again going back and reassessing the energy field with your hands, and if it's appropriate and you're not in a hospital, using a pendulum. The eighth step is to ground the client by helping them be totally present in their body and then releasing yourself from their energy field. And the ninth step is evaluation of the whole treatment with the client. Evaluation, and then you decide on follow-up with that client on what would be helpful for them after the treatment. An important part of this process is learning how to do an in-depth interview with your client with a sensitivity to energy. So as we begin, I will talk to Andrea a little bit about how she's feeling, ask her some questions, and I'm beginning to connect with her energetically just in this part, but also listening with my energy sensitivity to any words that she might use that would give me some clues as to what's going on with her. So for instance, I could say, Andrea, how are you doing today?
I'm doing okay, but I'm feeling a little drained of energy.
And what's going on in your life?
I have a lot of stress right now in my life.
Can you tell me more about that?
Stressors with my family, stressors at work, stressors in my job.
Thank you. Now, I'm just stopping here to interject that it's very important as you ask these questions that you're not getting yes or no answers. If you are finding that they're saying yes or no, you need to switch to questions that are more open-ended. So for instance, I might follow up with Andrea and say, tell me about your work, Andrea, and how is that for you?
Well, right now I'm a nurse and I'm working night shift, so I'm always going against my body clock and sleeping during the day, and I just don't feel that I'm getting proper sleep and rest.
Sounds like that's challenging.
It is.
Well, thank you for sharing that with me. So that she gave me some information that was beyond just saying what her job was, because then I asked her to tell me about how that was for her. So that's a very good question. You can always say, tell me how that is for you. You can ask someone about their family, and then you can say, how is that for you? So those are the kind of questions that give us the information that's very important to start to understand that client's energy patterns, how they deal with stresses, and how they cope with things when they are under stress. So that interview is very important to give you information on what to do to work the best and highest with this client. So the second technique that I want to demonstrate for this level 2 class is the opening spiral meditation, which was given to us by Dr. Brew Joy. It begins, first of all, with the heart, making a heart-to-heart connection with your client. And I'm going to ask Andrea, is it okay if I touch your body as I do this? Okay, now you may relax and close your eyes. So I'm lightly putting my hand over her heart chakra, as well as connecting with my heart chakra so that it flows and connects. My heart energy is going down the arm through the hand into her heart. And we're making a beautiful heart connection. This is also a very good place to reset and reaffirm the attention for the highest and best for this person that you're doing the treatment on. Feeling the heart energy connecting, now I begin to open in the spiral by moving clockwise out and around to the solar chakra. I'm now beginning to feel the energy of the solar chakra opening under my hand. This opens the client for deeper work. So the heart energy is now spiraling out from the heart to the solar chakra. And now I continue clockwise and I come out a little bit further up over her shoulder to the high heart. The high heart point is between the heart and the throat. Visualizing that energy of the heart chakra spiraling out from the heart to the solar to the high heart. Usually it's best to hold each one of these points about a minute. I'm going to be moving a little bit faster for demonstration purposes. After the high heart, you continue to go clockwise out over that left shoulder, coming in over the left elbow to the spleen. So beginning to feel that energy, beginning to stimulate the energy of the spleen, opening and connecting to the heart. Then allow your hand to do a little bit of a spiral to the sacral chakra. Remember, the sacral chakra is in the lower abdomen. Feeling the energy connect, heart energy to the sacral chakra. Your heart energy and her heart energy are expanded. And now, as you continue the spiral, which comes over their right arm, you come out this time over the right elbow and up to the throat. It's always best not to physically touch the throat. Keep your hand above the throat. But you feel the energy. I feel that energy beginning to flow and open and bubble up under my hand over the throat. I'm continuing the spiral now, out clockwise over that left arm, bigger spiral, coming over the root. And remember, again, we don't touch the root. It's better to just allow your upper arm to rest on their thigh close to their knee so they can feel that your hand is safely in a safe spot, but it's energizing the root. And now I'm going to continue clockwise, bigger this time, out over the right wrist, coming up with a larger spiral to the brow. And this time I'm going to touch again lightly onto her brow with my hand, connecting her energy, her heart energy, and my heart energy. Larger and larger spiral. I continue now with this spiral that goes way out this time. It's getting much larger, and as it comes down to the knees, I put both hands on the knees, energizing the knees. You feel that connection, heart all the way out, larger and larger spiral, all the way out to the knees. Dr. Joy felt that the chakras work together well in pairs, and this is why he was led to begin to teach the opening spiral meditation as a way to open the energy for deeper work. Then from the knees, you continue the spiral out further from the body, coming all the way up to the crown. Feeling that energy beginning to bubble up under your hands at the crown chakra. Connecting still to all this wonderful heart energy that's flowing and expanding. And now, as you sweep out down to the ankles, you want to stretch your arms out as far as you can, because this is the most expanded part of the spiral and coming down to the ankles. Sensing a connection, your heart energy through your arms to each of these points, as well as her heart energy expanding out through the spiral. And then the last part of the spiral, you come way out onto the right side clockwise, continuing and moving up to the transpersonal point. connecting to that little spiritual ball of energy out at the transpersonal point. And now, this is the time that then you would move into other techniques, such as the chakra connection or any other techniques that you're led to do, because the client is expanded, the heart energy is flowing. It's a perfect opening to go and do further work from this point. Once you have finished all your work and you've done another energy assessment, then we close with the closing spiral. So we do the post-energetic assessment before we close the spiral. Because when you close the spiral, you're not closing the energy, but you're bringing that energy back in closer to their body so that they aren't so expanded that they would have trouble grounding after this. So to close the spiral, you start where you left off at the transpersonal point. Closing the spiral goes much more quickly than when you open it. You go quickly, you put your hands firmly on each place, which gives the message to the body that it's beginning to come fully back present. So I'm at the ankles, counterclockwise to the crown, counterclockwise to the knees, counterclockwise to the brow. See how much faster I'm going. Counterclockwise to the root, counterclockwise to the throat, and again your spiral's getting a little smaller now, to the sacral, to the spleen, to the high heart, to the solar, and to the heart. And that's how you complete the closing of the spiral, which you always do after your post-treatment energy assessment. And then you follow that with grounding and releasing yourself. It's generally recommended that when you do the spiral opening and closing, you do it hands on the body. That was the preferred way that Brujoy taught it. However, it's always possible to do any of your healing touch techniques with your hands off the body. So if someone doesn't like to be touched, you can do it with your hands in the energy field instead of actually touching the body. So now I'm going to direct Andrea on how to do the opening spiral on herself, which is so wonderful to do to begin to expand your energy for meditation. So Andrea, I want you to just take a breath and bring your hand over to your heart and begin to feel a sense of the heart energy opening. And you can just close your eyes now and relax. Feel that heart energy beginning to expand and open. And now see the energy of the heart moving up to the throat and then separating so that it goes out to each arm and down into the hands. So now you have a nice circuit connecting the heart energy flowing out through the arm and the hand and moving back into the heart. So we're going to do the spiral in a clockwise manner, and as you move clockwise, your spiral will get a little bigger and a little bigger. So begin by moving your hand clockwise out to your left and then coming in to the solar chakra. Now you sense the energy now flowing to the solar chakra, connecting heart out through the spiral to the solar chakra. And now you're going to continue the spiral to your left, coming up to the high heart chakra, which is between the heart and the throat. Again, feeling almost like a bubbling up of energy as that heart energy begins to connect with the high heart energy. Breathing it in, feeling the expansion. And now, Andrea, let that hand move again over to the left clockwise, coming down to the spleen, connecting the heart energy to the spleen. You feel the opening, the stimulation of the energy as it begins to expand. Now the spiral continues just a partial spiral down to the sacral energy, the sacral chakra, and begin to feel the connection with the heart energy into the sacral chakra. And then we're going to continue the spiral, and again it's going to go more to the right as it goes clockwise, coming out a little further and moving up to the throat. And allowing that energy just to flow into the base of your throat and feeling the connection from the heart energy moving out through the spiral all the way to the throat. Now, as you continue the spiral, let that hand move over your left shoulder and out over the left shoulder, coming in over the elbow and moving to the root chakra. So now you feel the energy of the heart connecting with the root chakra. Beautiful spiral of energy, opening, expanding. Continuing the spiral that's getting bigger now out to your right side as it comes clockwise up to your brow. Very nice. Letting your hand connect with the brow chakra, but the hand is also bringing in the heart energy. So the spiral has gotten larger and it's all the way up to the brow. As you continue the spiral now, you're going to take that hand and go out beyond your left arm. And as you come in, you're going to bring your other hand in and hands on both knees. So both hands now are bringing heart energy into the knees. The spiral has gotten much more expanded. As we continue the spiral now, let your hands both now come out to your right side, continuing clockwise up to the top of your head, the crown chakra. And you're feeling that beautiful heart energy flowing into the crown chakra. Now continue clockwise again, out to your left side, expanding that spiral out about as far as you can reach and coming down to your ankles. So both hands now are on the ankles and the feet, bringing that spiral all the way down to that lower part of your body, the ankles. So from your feet now, as you continue the last part of this spiral, you move out about as far as you can reach to your right side and connect with the transpersonal point above your head. So the spiral is completely expanded now. Let your arms come down and relax a moment. This is a beautiful time then to go into a meditation, to silently set your intentions for the day, to ask for guidance, or anything else that you would like to do during your quiet time. And then, as you come back to wanting to go into your activities of the day, we will start with the transpersonal point. And this time, to damper down the energy, we move counterclockwise. So from the transpersonal point, you're going to go counterclockwise down to the ankles. Continuing counterclockwise to the crown. Continuing counterclockwise to the knees. Continuing counterclockwise to the brow. Continuing then counterclockwise to the root. Continuing counterclockwise to the throat. Continuing counterclockwise to the sacral. Up to the spleen. Up to the high heart. To the solar, and then into the heart. Now you may open your eyes, see how you feel. It's always good to move more quickly as you close the spiral. So you don't need to spend as much time on the closure as you do on the opening. The closure is just touching each of those areas, whereas the opening we usually spend about a minute on each position. So that's how you do the spiral meditation on yourself. So now I'd like to demonstrate how you put together these 9 steps. And then within that whole sequence, I'm going to review the chakra connection again for you, and also bring in a new piece that we teach in level 2, which is called the body memory interview. And then we will proceed with back techniques, which is also new for you in level 2. So the first thing we already did with Andrea, the intake, so I won't repeat that. Then just to review, I always center myself again, ground myself, set my intention for the highest and best for the person on the table. And then we follow that with doing a pre-treatment energy assessment. Now we always teach that if you're going to use a pendulum, which is fine, it's a very nice energy tool, but we don't recommend using it in hospitals. We do find it's very helpful in other settings. And I'm just going to start with her ankles. And if the pendulum is moving clockwise, that tells me that the energy center there is open. With the legs, sometimes counterclockwise can be on the other side because there's like a polarization of energy where one side could be a little bit different than the other. So the fact that this is counterclockwise to me is reading open. Then I'm going to assess the root chakra, which is nice and open. The sacral chakra. Each time I move to a different chakra, I lift my hand so that I'm not just continuing the spin of my pendulum at each one. That's the solar chakra. It looks very open. Her heart is nice and open, her heart energy. Her throat. I'm just checking the energy of the 7 major chakras. I'm not doing the high heart and the spleen. Now I'm getting a little bit of discordant energy right over her brow. So I would take note of that as being a bit compromised. And then over the crown is nice and open. Then I'm going to check her wrists. And this wrist is a little compromised on the right, that it's going back and forth instead of around and clockwise. Right elbow seems nice and open. Right shoulder, I'm going to reach over and do the left side. And again, I generally with my pendulum get counterclockwise on the opposite side, but some people, either way, counterclockwise or clockwise is a good reading for the limbs. So right now, the only thing that I've picked up with my pendulum is a bit of a compromise over her brow chakra and the right wrist. So now you take your hands and you assess the energy field, just to feel what that energy feels like over and around the body. You're looking for differences from side to side, possibly either coldness or heat, any kind of prickly energy. Andrea's energy is really feeling quite good today, quite smooth. But if you're working with someone who's really ill or getting chemotherapy, you're probably going to feel a difference from someone who's very healthy, because the energy field will feel more cloudy, more congested. Sometimes with people who are getting radiation or chemo, their energy field might feel very prickly or very staticky. So now that I've done my energy scan, and she said at the beginning she was feeling a little drained, I would just make a healer appraisal that would say energy compromises related to stress in her life, because she mentioned that stress is contributing to her feeling drained. So that's my appraisal. The mutual goals are then finalized at this point. Once you know what the energy is is showing you, and once you've heard from the client what's going on with them, then Andrea, is it all right if we work today on balancing all your energy, especially any energy that's over your brow that needs balancing?
Yes, that would be
Okay.
nice.
So you finalize the goals, and then you go into your healing touch techniques. Now, we just showed you the spiral opening, which is a very good way to start with the techniques. But since you just saw that, and hopefully I've practiced it, I'm going to move right into the next technique we recommend, which is the chakra connection. You saw this in level 1. And remember, we start with the ankle and the knee and begin, and you can just relax again, Andrea, and close your eyes. And I like to begin with a nice big breath and allow the energy to come up from the earth through me, out through my heart, through my arms and hands, and begin to flow to balance these points between the ankle and the knee. We repeat this chakra connection demonstration in level 2 so that you're very clear with it, because it's an important piece to include in your healing touch techniques. But something we add at level 2 that I'm going to talk to you about is a demonstration to include with the chakra connection called the body memory interview. Now, as I'm moving up, I'm then going to the knee and the hip. If I was doing the body memory interview along with this, I would have told Andrea that I would have her stay a little bit more awake to answer questions for me. However, this demonstration gets into some personal information about the person's energy field, so I'm not going to ask Andrea to answer those questions for this video. But I want to talk to you a little bit about it because it's demonstrated in level 2. So once I go from the knee to the hip, then I go over to the other side, the ankle and the knee. Now, if I was doing the body memory interview, at the very first position, I would begin to ask my client, can you tell me any health challenges you remember in this part of your body? Any accidents, any illnesses, any challenges of any kind? And the energy of your hands over these different parts of the body begins to bring up the memory of anything that was a challenge of health in the past. I'm moving now up to the knee and hip, and I would probably ask a question at this point. Do you remember ever having any problems with your knees or your hips, especially on this side that my hands are on? And they then often will bring up a memory if there's something in the past that was going on with their legs. Sometimes I ask the question, has there been any kind of difference between your right and left leg as far as strength or stability? This is another good question. Looking for what the pattern is with the legs. Then you're going to go to the hips, remembering that once you get to the top of the legs, you balance across hip to hip. So I'm beginning to feel the energy flow between my hands, connecting the hips. This interview isn't recommended the very first time you see someone, because you want to develop a trusting relationship in order to ask these kind of questions of the body. So it's usually good to use with someone you've seen several times. So now at the hips, again, I might ask the client, do you remember anything with your hips, with your upper legs, that have ever been a health challenge for you, or perhaps an accident? So now that that's feeling balanced, I'm going to go to the root and the sacral. And with the root, you'd ask questions about the lower part of the abdomen, the intestines, the reproductive organs, questions if someone's had children, if that was normal for them, normal deliveries, whether they've had elimination problems, whether they've had anything like diverticulitis or any issues with their intestines. Again, I'm not going to ask this of Andrea, but I'm giving you some ideas of some of the things we want to ask when we're doing this body memory interview. So then I move up to the sacral and the solar. And at this point, then we would move with some questions about the stomach, the pancreas, the liver, any kind of metabolism in the body, any digestive problems. What we're looking for is energy patterns that have developed over time, especially in relation to stresses in the body. So this gives us a lot of added information that sometimes is not remembered when you're doing the initial intake. So now from the sacral and the solar, I add in the pancreas. And again, a good question might be, have you ever had any hypoglycemia, hyperglycemia, any kind of sugar problems? Again, talking about digestion can be very important here. And you also can think through about the back at this point, because you're not doing this, you don't turn them over and ask the same questions, but you could say, thinking about your mid-back. Have you ever had any issues with your back? So these are just some of the ideas of questions that you can ask. Now I'm moving to the solar and the heart. When I get to the heart, I'm more directed to ask questions such as, have you ever had any issues with your heart? Any kind of circulation issues? Any kind of arrhythmias? How's your blood pressure been over time, etc.? So those are issues to ask about the heart area as well as the lungs. You can ask about the lungs, any breathing issues. And when you ask these questions, it's also very helpful to say, what was going on in your life at that time? This will help you see the energy patterns. And now I'm moving to the heart and the high heart. And again, high heart is over the upper chest. So you can say, have you ever had any problems with asthma, with breathing? And the subsequent question, tell me what was going on in your life at that time. So often it's related to stress. A child might start having asthma when they're 2, when their parents get a divorce, then it gets better, and then maybe it gets worse when they have to move to a different place and start a new school. It just begins to show you how the energy patterns work. And now at the high heart is that clue to go to the arms. So I would go to the wrist and the elbow on the right side. And as I balance between the wrist and the elbow, again, I would ask questions about the right arm, the right hand, any fractures, any injuries. All of the instructors in level 2 classes do demonstrate this body memory interview. However, some will have the students practice this in the class, and some choose not to have you practice it. So I think it's very nice that you can see the demonstration again, because too often if you don't practice it in the class, you kind of forget how to do it. So now I'm going to the elbow and the shoulder, and I would again ask questions related to the upper arm. Have they ever had a dislocated shoulder? Have they ever had a fracture of this arm? Have they ever had any problems with the right arm? Once that is balanced, I move over to the other arm. And certainly if you're working on a person who's quite large, you can walk around the table. You don't have to reach over them. So I'm beginning to balance the energy between the wrist and the elbow, seeing it and feeling it flowing back and forth and balancing. At this point, I would ask questions about her left arm. Any problems that she can remember with her arm, any challenges with strength, mobility. Now I'm moving to the elbow and the shoulder again, balancing the whole left arm. And then I move up to the shoulders, across the shoulders. And this is where I would also ask the person about upper back issues. Have they ever had any upper back pain? Any problems with the back in this part of their body? And after you balance over the shoulders, you're going to come back to the high heart and the throat. Just reminding you not to touch the throat, holding your hand over the throat chakra. But here you would ask about thyroid problems, sore throats, strep throats, any kind of voice issues, laryngitis. What's interesting is every person has vulnerable energetic areas in their body. So some people might have strep throat when they get stressed. Some people might have diarrhea and intestinal problems. Some people might have headaches. Some people might have breathing problems. So it can vary depending on their vulnerable energetic areas. Then I move to the throat and the brow, energizing between the throat and the brow. And again, moving up with questions about headaches, head traumas, anything that would be in the head as well as the sinuses. This is a good time to ask about sinuses, any kind of health issues. In the head, behind the eyes, ears, hearing problems. Then moving up to the brow and the crown. At this point, I might ask them if they've ever had a seizure, if they have any problems sleeping. Again, think about some of the issues with the brain, any accidents where they might have had brain trauma. Really important to find out. You learn so much more from this body memory interview than you do from a regular intake. So it's really helpful to do this with a client. But again, it's something that you want to prepare them for ahead of time. I'm moving now to the crown and the transpersonal point. You want to have your client know you well enough so that if you say, next time, I'd really like you to stay more awake so that I can ask you questions as I'm doing your treatment. And then they'll know what to expect. So now I've completed the chakra connection with the body memory interview. And we can move on to the back techniques. I'm now going to demonstrate the back techniques. It's always ideal to start with the chakra connection, as we did just previous to this. A chakra connection to balance and connect all the chakras and the energy on the front. The back will respond better if you've been able to do a chakra connection first. So once your client is comfortable face down on the table, you're going to start with penduluming the back. I usually start from the bottom and check from the base of the spine up. But it doesn't matter. You could start at the top and check going down. But with this intention, you are checking each vertebrae with your pendulum, looking for if there is any compromise, any energies that are not balanced in the spine. I'm noticing right here in her mid-back, it's somewhat open, but it's also, the pendulum is showing an elongated oblong here, which isn't quite normal. So a little bit of tension or compromise of the energy in that part of her back. I'm getting up closer now to the shoulder blades. I'm in between the shoulder blades, up into the thoracic area. And now back and forth over the upper thoracic is showing me with the pendulum that area also is compromised energetically. And now I'm moving up into the cervical area, and that is a little bit congested also, a little bit open at the top. So once you've assessed with your pendulum, then you want to do a hand scan and notice how it feels to your hands, especially over those areas like her upper thoracic and her mid-back that were showing more compromise with the pendulum. Just notice how they're feeling. It's actually, I'm feeling a little bit of temperature difference where I'm feeling those compromises in her upper thoracic and her mid-back. The rest of it feels pretty smooth. And then I'm actually going to assess all the way down the back of her body. But the focus is on the back and the vertebrae. Then once you have done your hand scan, you want to do a visual scan of the back. And I will move down to the end of the spine where I can look at the spine from the middle of her back, looking up to see if there's any asymmetry of her shoulders or her hips. One might be higher or lower. You look for whether there might be any curvature in the spine. So you're doing a visual scan. So once you've completed your visual scan, then the next step is to open the lower body, starting with the foot and the ankle. So I'm going to put my hand, again, palm of the hand against the sole of her foot, and begin to balance the energy back and forth, just as you learned with your chakra connection. Balancing back and forth, bottom of the foot up to the ankle. Feeling that energy flow. It's important to open the lower body as you begin to work with the back. Then you move up to the ankle and the knee. Then to the knee and hip. So now I feel that energy flowing nicely between my hands. And if it feels like it's more congested, you might need to hold these areas just a little bit longer. Depends on what that person's energy is moving like and what it feels like. So once you get to the top of that hip, you go to the other foot and ankle. Again, the palm of the hand against the bottom of the foot. Back and forth, the sole of the foot to the ankle, back and forth. Feeling that energy filling the foot and ankle. And now moving up to the ankle and the knee. Your hands are touching, but they're not heavy. You want to make sure that you're not pressing on these places. Touching, but not heavy. And seeing that energy flowing from your palms, and then connecting back and forth between the ankle and the knee. Now I'm going to move up to the knee and the hip on this side. Connecting knee to hip, opening up this lower body. The flow is really balancing very nicely, and probably that's because we did a nice chakra connection first. It really helps to have that body balanced first before you turn them over. And then at the very top of the hips, you balance across the hips, just as you did with the chakra connection. Back and forth, hip to hip. Till you feel a connection between your hands, hip to hip. How are you doing, Andrea?
I'm doing good.
Okay, you be sure and let me know if anything's uncomfortable, all right?
Okay.
So after you've balanced across the hips, you've now opened and connected the lower body on the back. Then the next step is energizing the spine. You put one hand on the base of the spine and one hand at the top of the neck, in the cervical area, and you send energy back and forth again through your palms, and beginning to see a flow between your hands moving up and down the spine. There are really two positions you can use for this: the palm of the hands, or more specifically, you can use your fingers. And sometimes the fingers feel a little more intense for the person than the palms. Can you feel a difference, Andrea?
Yes, I can.
How is it different?
It feels more intense with the fingertips. With your fingers.
With the fingers. Okay, she says more direct. So you may want to experiment both ways. This sends the energy up and down the spine as well as using your palms, up and down. So we've opened the energy of the spine, and again, you can either use your fingertips or the palms of your hands. The next step of the back techniques is what is called the vertebral spiral technique. With the vertebral spiral technique, you start with ultrasound from your palm and out through your first two fingers and your thumb. And you can do this either on or off the body. You begin to spin the energy about a dozen times, spinning it. Just see a little wheel of energy that's opening and spinning, and you're going to open that on either side of the spine. And then you pull up. Then you go to the other side of the spine, spinning counterclockwise on the left side of the spine. About a dozen times, opening that energy and pulling up like you're pulling up a string. You do this all the way down the spine. I like to do it touching the back because many of my clients like to be touched, but if the person doesn't want to be touched, you could do it off in the energy field about a dozen times, pulling up like you're pulling up the string on a top. Some people like to go back and forth. The other hand is used as a marker, but it also helps keep the energy flow going on either side of the spine. If you're very ambidextrous, you can do your clockwise on one side with one hand and your counterclockwise with the other hand. I like to use my dominant hand for both, so I'm going to do that. So I'm doing clockwise on the right, pulling the string up, and then counterclockwise on the left. This is really a nice way to open up the spinal energy and pull the string up. Spinning, spinning like a spinning of a little wheel, and then pulling up on the string. Then going back to the other side. Just imagine that all those little tiny muscles on either side of your spine are beginning to relax as you open the energy doing the vertebral spiral. In case you forget which way to go on each side, this back technique was actually brought down through the Hopi Indians, and they like to see the symbol of the back as being the cornstalk. And if you think of a cornstalk with the leaves coming off the stalk, they go this way, don't they? So that will always help you remember which way to circle your vertebral spirals. Clockwise on the right, counterclockwise on the left, just as though you're looking at a stalk of corn with the leaves coming off. So continuing down the back, spinning the energy on either side of the spine, and then pulling up and out. Spinning. Is that comfortable for you?
Yeah.
Okay. Spinning. Again, you almost feel like you're stirring up the energy and then pulling the energy up like a little string. This is very effective for opening up the energy on either side of the spine. And sometimes after you do the vertebral spirals, as I'll show you, we always recheck the energy, because sometimes you don't need to do any other back techniques after this. However, we are going to demonstrate something called the Hopi back technique as the next part of this, just to show you how it works. So vertebral spirals, I'm continuing either side of the spine, right side clockwise, left side counterclockwise. You're spinning about the size of, let's say about 2 to 3 inches, in case you're wondering. You know, if you make it really, really small, it doesn't really cover those muscles as well as if you make it just a couple inches in your circles, your spirals. So moving down again on the right clockwise and the left counterclockwise. And now we're down at the base of the spine. So that's as far as we need to go. And the next thing then is to check and see how does that energy look after doing the vertebral spirals. See, you can see the energy is much more open than it was before. Much more open. And it looks like that mid-back that was compromised before has opened up with the vertebral spirals. Actually, the spine looks very open right now with this vertebral spiral work. But with Andrea's permission, I'm going to demonstrate a Hopi technique on the back, because if there was an area that was still compromised, we would do the Hopi back technique. So, Andrea, is that all right with you?
Absolutely.
And would you prefer that I do it on this mid-back where you had some compromise, or up higher?
The mid-back.
Okay. So, to do the Hopi back technique, there are 3 steps. The first one is you put your fingers on either side of the spine together like you're lasering in energy. You connect your wrists so that you're forming like a triangle over the spine. You could think of it as a triangle, as a pyramid. And the energy of your fingertips is going to laser in on either side of the spine and begin to create an energetic opening. You may begin to feel the etheric fingers of your hands sinking in on either side of the spine. Sometimes you actually feel like the energy fingers are sinking in deeper and deeper. And if someone has a pretty strong energetic compromise or energy block in their spine, it's like you're beginning to open up the area on either side to pull out that energy block. Sometimes when you're doing this, you might feel even some vibration. I've seen it where my fingers start to vibrate. If that happens, you just hold the lasers on either side until the fingers stop vibrating. Then you know it's time to go to the second position. The second position is wrapping your fingers and your thumbs, the thumbs on one side of the spine, the fingers together on the other side of the spine, and beginning to connect the energy from the thumbs to the fingers all around the spine, as though you're wrapping that spine with energy around it. So, energy from the thumbs, energy from the fingers, moving around the spine. This part of the spine, holding your fingers about this far apart, it works very well. If you're working with the lower spine, those vertebrae are bigger, and sometimes you have to hold your fingers a little further apart to actually get the energy to wrap around the spine. So you hold that until you start to feel that connection with your fingers and your thumbs all the way around the spine. And while you're doing that, it's very common that you begin to feel like an energy collection in your palms and your hands as that begins to collect. So then the third step of the Hopi technique is actually pulling the energetic block up and out and then resealing it. Now, as I begin this process, you may not have learned this in the class. It's something I particularly like to include. I like to ask the body and ask that person if their back is ready to release this block of energy in their back, because it's been a protection there for it. And I think it's a good way to get the energy of the body to cooperate by saying, are you ready to release this energy compromise in your back? And what do you think, Andrea?
Yes, I am.
Okay, thank you. So once you get that feeling that you're all in agreement that this is okay, you ask the person to take 3 deep breaths. You make sure you're very well grounded with your feet, and you breathe with them, and then you're going to release on the third exhale. So Andrea, I'd want you to take 3 deep breaths, and I'll breathe with you. That's her second breath. As she breathes out, you bring it up through all the layers, and then you bring your hands right back down to seal that area. We never pull energy out from any part of the body without resealing it, refilling it. So you hold that area to reseal and refill until you feel that it's very balanced and connected. How are you doing, Andrea?
Oh, great.
Good. So once I feel that it's sealed, I do a little hands in motion to smooth it out. And if there were several energy compromises in her back, I would go back and reassess. But it's always good to reassess after you've done a Hopi and just make sure that everything is open. Generally, if there's some spots that were really stuck, usually one Hopi technique will open the whole back. But if it doesn't, you may have to go back in and do a second Hopi over whatever place is still showing energy compromise. But right now, the flow is really nice in Andrea's back and spine. So it feels very good. The other part of the back techniques is then feeling for any leaks that might need sealing if there was a back injury or a back surgery. If there was a back surgery, you might find a place that feels like it's a little cool air, and you would seal the leak, as we talked to you about sealing leaks. The other thing is using ultrasound, and you can use ultrasound over any nerves. If Andrea had some sciatic pain, I could do ultrasound over the sciatic nerve, and that helps reduce inflammation. You might want to work on some of the joints. For instance, if she had some issues with her knee, you could ultrasound the knee joint through the back of the knee. She had said something about her wrist, and you could ultrasound the wrist and open up that area. You could also ultrasound any muscles. If she had like a trigger point in her back at this point up behind her shoulder blade, you can do ultrasound to help release that tense area. So all of those things are very helpful to do. So you want to work wherever it's called for on the back. And then you do the same kind of up and down position, top and bottom of the spine, as you did at the beginning, only now you're seeing it as like a closure for the spinal energy, balancing it and bringing it to a close and a completion. So your hands at the top. And at this point, I generally use palms versus fingers because it's more comforting, more nurturing, more settling as you end. And then to sweep and close, you keep your left hand at the top of the back and you just sweep over the field. You can do this in the field or actually on the body. Lightly sweep the energy field with your other hand, smoothing it out after all of that work. Smoothing it out. One hand at the top of the spine, the other smoothing down the spine. And then I like to bring my hands down the legs also and hold the feet. So that completes the back techniques, a very effective way to help people with back problems. So I hope you will practice this so you feel very comfortable with it. So after you've completed these back techniques, you will want to turn your client back over to do a final energy assessment and ground them. So Andrea, if you would just move back over onto your back, slide down a little bit, very good. So it's always nice to recheck before you ground and close. You're going to recheck the energy, which I will do on her major chakras again, just to show you how I'm doing this. Her chakras are nice and open. A good spin. I'll recheck this wrist, which now looks open. So you just want to recheck any places that were compromised before. And then, again, a hand scan. Her energy feels very smooth, even, and balanced. Feels very good. And so then, to end, we want to make sure she feels grounded. It's time to come completely back into your body, rubbing the lower legs again and the feet, making sure she's very aware of where she is and that the treatment is coming to an end. All right, so feel complete, take a nice deep breath. So then I want to release myself from her energy field. So I will visualize myself stepping out of her energy field and actually separating myself again from her energy. So that takes us to the 8th step, and then the 9th step is when you talk to your client at the end and say, how was that for you? And you evaluate the treatment and you talk about any follow-up that would be helpful for her to do at home or the next session. So that is the 9 steps. I hope you could see the whole flow and sequence. The next technique I want to demonstrate for you is modified mind clearing. In level 1, you learned mind clearing, which is a wonderful technique for calming the thoughts and balancing the energies throughout the brain and throughout the head. Modified mind clearing works very much the same, but it uses the palms instead of the fingertips. So in level 2, we show you how to do modified mind clearing. So you begin with your palms right at the top of the shoulders, lightly at the top of the shoulders and the top of the chest. Here you're making a connection again energetically to attune with your client and feeling that energy going into the throat and opening the throat and the upper chest. Then the second position, you're going to slide your hands under the neck at the top of the spine and your palm over the brow. Remember, with regular mind clearing, we actually do this with the fingertips back and forth. But with modified mind clearing, these positions are with the palm of the hand instead of the fingertips. Some people like this better, so you might want to try it both ways and see which feels best to you and to your client. So I'm sending energy back and forth now between my hand that's on the brow and my hand that's on the base of the neck, beginning to feel a balancing front to back with the head. The third position is the same as with the regular mind clearing, where you hook your fingers behind the occipital ridge and you put traction on the neck as long as the person doesn't have a neck injury. Is this comfortable for you, Andrea?
Yes.
Okay. So you might want to ask that question. If someone does have a cervical neck issue, that might be uncomfortable. So be sure you check. But I am really putting traction with my arms against the table. And it feels real good if you have a healthy neck because it stretches out some of the spaces between the vertebrae. It makes the neck feel more elongated, more open, and it opens that energy. It also begins to open the energy along the occipital ridge, where a lot of people hold tension. So after you've held that position, then you come with your palms at the top of the head, with your fingers coming down on either side, the palms at the top at the crown, the fingers coming down. And at this point, you're sending energy through your hands all throughout the brain. This is a very nice way to balance the brain. Feel the energy of light from your hands filling the whole head with that wonderful balanced energy. The next position, where we in the other mind clearing used our fingertips above the ears, we're actually going to put the palms right about where the temples are and let the fingers come down to about the TMJ joint, which is your jaw joint. So palms over those pulse points that are right a little bit behind and above the ear. And this is truly considered the brain balance point. So you're balancing back and forth. I like to visualize when I'm doing this, the energy flowing back and forth, almost like an infinity sign. That's such a nice way to see the energy flowing and connecting left and right sides of the brain. So you hold each one of these positions approximately a minute. And then the next position, you're putting your hands right along the brow, with the palms along the brow instead of your fingertips. Some people, when they do this, like to stand up so they have a little bit better position with their arms, but you can do it either sitting or standing. Holding this position, sending energy through the brow, opening the brow center. And then your hands go right over the eyes. This feels very good to refresh your eyes. Put the hands right over the eyes. Sometimes if someone is having a headache and I'm doing this, I'll just ask them to visualize a nice, cool blue color coming from my hands into their eyes, refreshing their eyes. The next position is holding the cheeks. This includes the TMJ joint and comes down to the chin. This is a very nurturing hold. Again, I recommend either regular mind clearing or modified mind clearing to help people who are having issues with their head, with headaches, possible post-accident issues with some trauma to the brain, or just if they're having trouble settling their thoughts and getting to a peaceful place. And then the last position, you come back to where you started with the hands on the upper chest, holding that spot. It's easy to do, but very effective. Now I'd like to review for you the headache techniques. Because there's so many techniques in level 1, we were unable to fit them all into the level 1 video. So I want to review those techniques because they're very important. There's 4 different kinds of headaches that we talk about. The first one being tension headaches. And if you're working with someone with tension headaches, there's usually involvement of stress and tension in the neck and the upper shoulders. So therefore, it's always good, if you can, working with headache techniques, to do full body techniques such as the chakra connection to get them to completely relax, to begin to let go of some of that stress. It's also good to put your hands on their shoulders as you begin working with a tension headache to soften the energy in the shoulders, because very often the energy in the neck, the upper shoulders, is very tense. So with your hands, transferring energy through your hands, you can begin to soften this area of the body, which begins to open it. I always like to make sure too that the chakra at the top of the head and the throat and the brow feels open. And then it's very effective with tension headaches to use your hands in motion, beginning to smooth that energy over the head, the neck, and the shoulders. Over the front, the sides. And usually when you're working with a tension headache, especially if you've done a little bit of relaxation in their shoulders and neck first, you really begin to see their face relax, the muscles in their face will become more relaxed, and the tension headache just seems to drain away. The other thing that's very helpful, as I said, with the mind clearing, is to add mind clearing to your treatment with tension headaches. So that is how we do treatments of tension headaches. The second type of headache is the sinus headache. And with the sinus headache, there's generally very much congestion over the sinuses in the face. And you can usually feel that with your hands. Again, it's very important when you start working with sinus headaches that you make sure the throat is open so that the energy can flow through. The brow is open back and forth. And the crown is open right at the top of the head. It's very important because you want that congestion to be able to flow out freely. I really like with sinus headaches to use ultrasound. This is what's recommended. Remember, as you learned in level 1, ultrasound is sending a stream of energy from your palm out through your thumb and your first 2 fingers so that it's almost like a very narrow stream of energy coming through your fingers, which is much more intense. It can go in and begin to break up congestion in the sinuses. So you want to use ultrasound and then clear with your fingers or with your hand. And when I do it on one side and someone's got sinus headaches, they generally can feel one side beginning to clear before the other. And then you want to be sure and ultrasound the second side as well. so they feel very balanced. Ultrasounding the sinuses and then clearing the energy away from the sinuses, clearing the congestion. That's how we would do it with the sinus headaches. The third headache I want to demonstrate, the headache technique, is working with the migraine headaches. With migraine headaches, generally it's one side over another. Usually people with migraines get some sort of signals that they're getting a headache, and usually it's a spike of energy on one side or another side. So you talk to the person about where they feel their headache. You want to see where you feel that spike of energy and move to the very edge of it. Because if your hand is in the energy spike, it's going to increase the discomfort of the headache. You want to go to the end of the spike and begin to smooth that. Smooth that area until it begins to decrease. Sometimes this takes a while. It could take 10 or 15 minutes to smooth the spike of, I'm just imagining that she has a spike of energy coming out this side. It could be this side, it could be the back, but let's just pretend that her migraine headache is on the left side. So you want to look for where the energy spike is and smooth that energy until you can get closer to the head. Now, if you're not sure you're feeling the energy spike, there's a very good way to test this. All you have to do as you start doing the work is say, tell me when you feel my hand, because a person who's having a migraine headache will begin to feel your hand in that energy spike. You want to move out to the edge to where it's comfortable for them. So let them guide you as to where that energy spike is. And you will continue to work until you could get close to the head, because it's almost like there's a leakage of energy coming through that spike. Once you can get closer, then you want to hold the head and put some energy into that place to seal it. So once you can reach your hands on the head with no discomfort from the client anymore, you really want to see yourself sealing that area so that any kind of leakage of energy is sealed. And this usually is very effective for relieving migraine headaches. And it's ideal then if you can follow that with perhaps a chakra connection or a balancing. The fourth headache technique that I want to demonstrate and talk to you about is trauma headaches. And this usually occurs when there's some traumatic injury to the head through an auto accident or a fall or a blunt instrument hitting the head. And when you have a trauma headache, you definitely want to assess around the head for any kind of energy leaks, which would be related to the trauma to the brain and to the head. And if you do feel an energy leak, then you would want to go to the very end of that leak, bring the energy in, and seal that leak wherever it is. And then, of course, it's very good to do mind clearing to connect and balance the brain into more of a normal pattern. And if possible, also do a chakra connection. But after brain injuries, there can often be cognitive disturbances. I worked on a young woman who was stuttering after a car accident, and no amount of medication seemed to take away the stuttering. And by working with her with the trauma headache relief and the mind clearing, her stuttering went away. It was really beautiful to see. Now, Andrea has had a direct personal experience with head trauma, and I would like her to tell a little bit about how that worked with her. I'll come around the table so that I can sit next to her, and she can tell a little bit about how the healing worked for her with trauma.
About 2.5 years ago, I had a traumatic brain injury from an accident. It was suffering from daily migraines, dizziness, a stutter, aphasia, which is difficulty saying my words. And it wasn't until a friend of mine who had taken level 1 healing touch started practicing her level 1 headache techniques on me that I started to find relief from my severe migraines and headaches.
So then what did you do next?
I then took level 1 healing touch so that I could learn how to do the techniques on myself, and I practiced them every day, which dramatically helped my headaches.
That's a wonderful story, Andrea, and I'm so happy that you were willing to share it because it's such a true life illustration of how this work can be so powerful in helping to heal something like a traumatic brain injury. So thank you, Andrea. I hope you've enjoyed this Healing Touch Review of Techniques Level 2, and I hope that you find it helpful to practice these techniques regularly. In the Level 2 classes, there is much very helpful information shared about specific health concerns and what healing touch techniques would work best to work with these concerns. The most important part for your healing journey is to deepen your own wellness and development, as well as practicing these techniques. Remember, the most important principle is that energy follows intent. So if you set the intent for the highest and best for whoever you work on, trust that the energy will go where it needs to go, even if you don't always remember the specific hand placement for each technique. Heart-centered intention is the most important part of healing touch. So also remember this for yourself, to set the intention every day for the highest and best for yourself, as well as everyone else that you interact with. Healing Touch classes are endorsed through the American Holistic Nurses Association, which also offers continuing education credits for the classes, as well as the California Board of Nursing and the National Certification Board for Body Workers and Massage Therapists. To take Healing Touch classes, please go to these websites. To order DVDs of these review of techniques, please go to my website, thehealingjourneys.com. Thank you very much, and I look forward to you joining me on this journey for Level 3 techniques in the next video.